Great. Hello, everybody. We'd love to welcome you to today's business support series. Today, we are going to hear from She is a specialist in Chehalem insurance and Medicaid. And today we have an opportunity to ask many questions. We want to find out who we need to go seek out and how and all that great stuff. And there are some upcoming deadlines that will be shared. So I'm going to go ahead and throw it over to and welcome. We're glad that you're here today.
So good afternoon, everyone. My name is Sukheenai. The correct title would be I'm just independent insurance broker, and I do health insurance and Medicare, group health insurance, life insurance. Not specialist on Medicaid, but why I'm doing this because I have been selected to be part of the Agent Partner Program. Former name is DCBS, and current name is Oregon Health Authority. And part of the Agent Partner Program with the state of Oregon is to be a messenger about what's going on with Oregon Health Plan. And my office is in Newburgh, and I would like to thank you, McMinnville Chamber, and all of you who prefer to be in the shade, not outside in the sunshine, to come and listen and talk with me today. So again, the business name is Chehalem Associate. And we have a punchline is every day is a sunny day. Before I move to my slide presentation, will I have a privilege to hear from you who you are one more time, even though some of you I do know. Would you please introduce yourself?
Lynn, let's go ahead and start with you.
Yeah. So hi, my name is Lynn Smargis, and I am a senior care consultant with Senior Care Authority, and it's my own business. So I have I help people with elderly care, senior care placement, peace of mind visits, and I work with people all the way from McMinnville here where we live all the way over to West Portland.
Excellent.
Dan?
I think Dan, you're next.
Hi, I'm Dan Cushing. I'm the Government Affairs Director at Yamhill Community Care. We serve about 38,000 Medicaid or Oregon Health Plan members in Yamhill County, as well as parts of Polk and Washington counties. Nice to be here.
Becky?
Hi, everyone. I'm Becky Turner. Apologies that I don't have my camera on like everyone else does. I'm having some issues with it today, so sorry about that. But I am with PBT Practice Solutions, where I specialize in helping private practice doctors streamline the business side of their operation. And then I'm also with J&W CarStar Collision here in McMinnville, so a little bit of two different worlds, but I'm happy to be here and excited to meet you all and see what we can learn today.
Rhonda, I think Dawn just coming in, right?
Yes, I hope so. Yes, I don't see her coming in yet. Do you see somebody coming in the room?
I just clicked.
It looks like she's here. Somebody let her in the room. She's here.
I did.
Yeah. Oh, thank you. Okay, so I didn't see her. Thank you.
But I don't see Dawn.
Dawn, we're doing brief introductions. If you'd like to introduce yourself.
Gabby, go ahead.
Oh, hi, I'm Gabby, Ohm's assistant here at Chehalem Insurance.
And she speaks Spanish. Yeah.
Yes.
Are we waiting for Dawn? Hi, Dawn.
Dawn put in the chat.
She said she's driving.
She's driving.
All right, so I'm going to get started, Dawn. You can introduce. We're chatting. So, as I said, I'm part of Agent Partner Program, and I feel like it's my job to talk about Medicaid redetermination. But before I started, I have to put the disclaimer that this is not about politics. What's going on is about what's happening and what we all can do to help for Oregonian, and if we focus into Yamhill County, to have health coverage. Oop, do I see slide change? So this is the agenda. So what is it and who will be affected and what to do, where to get help? And not only that, I want to talk about the Medicaid redetermination. I want to emphasize that everyone should have health coverage. And because with these unwinding things, I hope to prevent two things, that people not to have health insurance or health coverage and go into emergency room. And then people who are on Oregon Health Plan, if they receive a letter or notice, they don't have to be freaked out. They're actually simple thing to do. So let's get started in then. So the name itself, so formal Medicaid redetermination. Medicaid is a state, I'm sorry, federal, the term is for people who has an income meet the limit of the federal, and then our state using the same level. There also are names of this one that you're going to see the word PHENs or Medicaid unwinding renewal. But it is that during the pandemic, the government, the Congress has passed the law that we're going to have something that my nickname is called the pandemic protection, but the formal name would be public health emergency. So it just ended on March 31st, year 2023. And beginning in April, the whole states of the nationwide have begun to do Medicaid redetermination. For us in Oregon, Medicaid, for people in Medicaid, we use the term Oregon Health Plan. So far, so good. And on this pandemic protection is when it ends or public health emergency ends is some other benefits too. For example, food, but I'm going to focus on the health coverage only today. So again, so now we're back into talking just only for state of Oregon. We're going to call it Oregon Health Plan. So the process has already begun on April 1st, 2023. A matter of fact, state of Oregon, we have started in May, and it will go to October 31st of next year. And in their prediction, they're thinking that it will be 1.4 million of Oregon Health Plan will receive a letter, text, and emails and any notice. And the thing is that the letter or any information that they will get, it will come in batches. There's a selected group of people they will send to. And the recipient have about 5 months to respond to Oregon Health Plan. And with all this, the state of Oregon think there will be about 300,000 of Oregon Health Plan recipient rule file is eligible. And this is the point of we sharing information to making sure that those 300,000 will continue to have health coverage. I do not monitoring the chat, so Rhonda, I hope you can help me. So back again on Oregon Health Plan income. This is based on the income, and you can see that we have the number of 2022, 2023. So far, anyone has any question at all?
So I'm assuming this is yearly income.
This is a yearly income, yes. This is a adjustable gross income. So this one, when we're talking Oregon Health Plan, so I'm going to separate into two groups. One is under age 65 and the other one is 65 and older. So for Oregon Health Plan under age 65, they're going to look into the income only and the number of family. And so let's understand people who will receive the Oregon Health Plan. So I'm going to go back to slides. So it's going to be people who meet the income limit and some people who have disabilities with the income limit, they will get Oregon Health Plan. And this is the key thing, what to do. If you log into any health insurance company, you're going to see on one tab of them, they're talking about Oregon Health Plan redetermination, unwinding, and this is what I want anyone who knows someone who on Oregon Health Plan to do this. making sure that they update the correct address, phone number, email addresses, and check mail often, meaning that's postal mails. And when they get it, they can do updated income by telephone call or submit the information. And last but not least, there are so many places they can ask for help. So what to do? Continue, carry on what to do. So when people see this, health insurance or health coverage is already daunting enough. So information that I'm talking today, I hope to make people feel like this is going to be an easy process, simple process. They don't have to be stressed out. So what to do is to check the mail, just like I showed in the previous slides. But there are going to be some people who will be automatically renew or continue. Like you see, people who have the correct information. And there will be some people who the Oregon Health Plan or Oregon Health Authority will send a letter and said, hey, please send me more information about your income. And you have to respond to do that. If you don't respond, you're going to lose your Oregon Health Plan. And another way that you can do is just resubmit the Oregon Health Plan application. So continue to what to do. Keep repeating this, just like, review the letter, make sure that all information is correct. So on the second bullet is about if you feel like, yeah, my income is going to be above the income limit. If you work, you might want to talk to your employer to looking if they have the benefit for you to sign up. And then some of the people who age 65 and older, they're going to go into a Medicare. And some people who Medicare is not only the people who age 65 and older, someone who has been disabled for over 24 months, they will automatically get Medicare. And last but not least, for among the 300,000 people that the state of Oregon afraid that they will lose the health insurance or Oregon Health Plan and no health coverage, please tell everyone, do not assume this is too expensive. Because if you next step for people under age 65, they might be qualified for the financial assistance that we call premium subsidy to the health insurance marketplace. Any questions so far? Wow, I must be doing so well.
I do have a question for you, Om. So if somebody is getting private, like is paying for private insurance, but they qualify for Medicaid, can they have both, or is it only one or the other?
Dan, you nod your head. Go ahead, Dan. Yeah.
Yes, Medicaid is always the payer of last resort, but a person can have some supplemental coverage and Medicaid if they want. They may not get premium assistance like just said, but they may have supplemental, and then Medicaid will be the last payer for whatever's not covered by the supplemental.
Okay, awesome. Thanks.
So I want to talk about that when we're talking about private insurance, and I'm going to go to the yellow bar on the health insurance marketplace. There are two ways that people can obtain this. I'm kind of jumping a little bit. So if your income is above the limit, you can buy health insurance we call directly to the insurance company A. And then if you have the Medicaid or Oregon Health Plan will be a second pair, just like Dan said. But if you are on premium subsidy, you cannot have Oregon Health Plan. You just have to choose one or another. But let's go to this pathway onto this one. So you see this, that there will be some people who still meet the income limit or have disability. So they will continue to be on Oregon Health Plan. So let's understand what Oregon Health Plan it is. So Oregon Health Plan in Yamhill County, when you apply, you're going to get a card, and the card would connect you to coordinated care organization, which is Dan is doing. So they will guide you who to see, who your provider who you can see and everything would have the full benefit. Full benefit means is for medical, you can see the providers, prescriptions, and you get the dental benefit too. So that would be some people who will remain on Oregon Health Plan. But the next one, this is the interesting thing. So this is the bridge plan or basic health plan. This plan will begin in July 2024. So when the government do things, or when the state of Oregon do things, they're looking to like 100% of people income limit to get Oregon Health Plan. And then they keep scaling up from 138% to 200%. If those people who the income limit meet between 138 to 200% in 2023, they're going to fall into, meaning the lost Oregon Health Plan, they're going to fall into the health insurance marketplace. But when July 1st of the year 2024, these people will roll back into basic health plan. It is that the state of Oregon call is to be a protection health plan. So people who income in between 138 and 200%, in July, they will roll back into the basic health plan that we call bridge plan. It is the same thing in the Oregon Health Plan, but it's a different name because of the scale of income is different. And then if those people who above 100% or above 200% of income, they're going to move into health insurance marketplace. And this one is for a group of people who under age 65. So if your income is meet the limit, you're going to get a financial assistance that we call premium subsidy. So you're going to put it in information and then to the healthcare marketplace or healthcare.gov, or you can talk to any agent that can help you. And then you will see that you will get saving. The saving that you receive, it doesn't come to your pocket. It will go to the insurance company. So for example, if your premium is $1,000 per month and you get $900 premium subsidy, you're going to pay monthly premium about $100 per month. But there are scale again based on the income. So if your income on the high level, but still in the limit, you may get only the premium subsidy only. But people who lower income in between 200% to 300, below 400%, there will be some cost sharing coming into this place too, meaning you get premium subsidy, lower premium, and also the cost sharing reduction, meaning the copay that our pocket is going to be lower. I'm going to pause here if you have any questions on the health insurance marketplace. Nope. So we're going to move to employee sponsor coverage. And this is the employee group that the business, can be just one owner and has to be at least one payroll W-2 employee. And the owner or the business owner have mandate to pay 50% of the premium toward the employee's premium. We're going to look into Medicare or TRICARE. So Medicare, this is for a group of people age 65 and older, or people who had disability at least 24 months. So Medicare, if you get out from Oregon Health Plan, and again, don't be despair. Medicare has a system that's called Extra Help or LIS, Low Income Subsidy. And the purpose of low income subsidy is that it will help this Medicare recipient lower the drug costs, because when Medicare come in, you're going to get the Medicare medical and then the prescription drug. But if you were to get the full Medicaid, and now it's getting a little bit trickier because for people under age 65, they look into just only the income. But people above 65, they look into income and assets. The asset doesn't including your primary home, your car, but it does include your bank account, how much you have, and sometimes they're looking into your IRA or those kind of things. So basically, if people who get LIS, if individual make less than 20,000 per year, or if they're married, make less than 30,000, I'm sorry, 20,000 or 30,000, they would be eligible for LIS or extra help. And the pink one is the uninsured. That's the purpose of us talking today, that please spread the word that look into the mail. If you're on organ health plan, respond back and do something with it. So again, who will qualify to organ health plan? So all ages who meet the income criteria. And again, I want to talk about a healthy Oregon. It just started on July 1st, year 2023 this year. This is Healthy Oregon has include people who meet the income limit, and regardless of their immigration status, they get organ health plan. And the organ health plan based on the county. For example, that I repeat myself that on Yamhill County, the CCO is Yamhill County. Different county have a different CCO. And again, people who under age 19 and people with disability. So where to get help? You can get help for organ health plan in Yamhill County. There are two places, Virginia Garcia's to get apply, one in Newburgh, one in McMinnville, and you can also apply or log into your account at one.oregon.gov. But I want to emphasize on this one, for if you really think that you're going to be out of the organ health plan, the next step is to go to healthcare.gov or that we call Health Insurance Marketplace to see that if you are eligible. And you can do a shopping things too. State of Oregon that has a website. It's called healthcare.oregon.gov that you can do window shopping. So how much you're going to get subsidy. You can do that on your own and apply directly or get to broker and agents. And the key date for open enrollment period will begin on November 1st to January 15th. And on Medicare, I already talked about the LIS, low income subsidy or extra help. You can go to Social Security Administration.gov, or you can talk to SHIBA and Medicare. And you can talk to a health insurance broker and agent. And again, if someone who already have Medicare Advantage plan or prescription drug plan, the annual enrollment plan period right now will begin on October 15 to December 7. So the deadline of this one means that if you miss the deadline, you cannot change the plan for or apply unless that you have a special enrollment period. I'm coming to pretty much the last slide, and this is the slide where you can get help. And State of Oregon have done a very nice job. On to benefit.oregon.gov, keepcover.oregon.gov. I would like for you to check on to it. And if you lose coverage to Medicare, this is the information that you can go directly to Social Security Administration website, call SHIBA at this number, call broker, insurance agent, and the marketplace. That's what the website I said, This is incorrect one. It should supposed to be healthcare.oregon.gov, but you can get a broker that will have a list of broker or place that you can go get help, an insurance agent. And I'm coming to the last slide. Any questions at all?
Can I get your contact information? Because I would like to sit and chat with you about some Medicaid and Medicare because I know I'm going to get clients who will need your help.
Oh, wonderful. Thank you so much. Gabby, would you mind to type in chat? Yep. So Dan, you have anything to talk about CCO at all? To explain that even though we're facing the shortage of the healthcare worker, but don't feel stressed out that organ health plan is not a good benefit. So I'm going to have Dan step in, and if you don't mind, Dan, say something about it.
Oh, sure. Again, I'm Dan Cushing. I'm with the CCO, Yamhill Community Care, and I put in the chat a link to our website that's accessible right from our homepage that actually has a list that said about phone numbers of Virginia Garcia, Unidos, and other people who are qualified locally to help get people enrolled. So in Oregon, we can't actually enroll people ourselves. Like we can't find someone who is low income and actually get them signed up. The state does that, and we're not allowed to really touch that part. And then once they get enrolled, then they become a member. We get them assigned to a primary care provider. And then we also do something called a health needs assessment. So they'll get, if the person has high health need, they'll get a special team to coordinate their care and make sure that they get a ride to their appointment, or that they're getting some follow-up on their prescription, or maybe they need behavioral health care. So we'll make sure they find a counselor or a prescriber who can help them. So yeah, for low-income individuals in our community, YCCO is a great health plan for them to have. And like said, we need to make sure everyone gets covered with something, whatever is best for them and their income and age
Yeah.
category.
So this is kind of like asking for help. Please spread the word that if you receive a letter, please don't, oh, cringe. There is a way to do it. And, we are here to help. And I want to add something if you have time. There is a new bill that has been passed. It's called House Bill 1529. What it means is that for not organ health plan for health insurance, and depends upon the insurance company, you would get the first 3 visits, including, either you meet with your primary care doctor or mental health. And for those 3 visits, you pay only $5. So it is very good plan that coming into consumer. So they can choose, if someone for in the insurance beyond my health for is under 65, they can choose a bronze plan if they just want to have something for catastrophe, but they can choose a plan that has this bill enforced into it. They can see the doctor 3 times a year, pay $5, and have a health take care of. Because the reason that if people don't have health insurance and they have the chronic condition, they're going to be afraid to go to see the doctor. And when something happens, they go to emergency, and it's going to cost them more, and they're going to be freaking out, and they will stop seeing any provider. So please help one another to help everyone have a healthy with the health coverage. I think we're good, Rhonda.
I think okay. That is great. Becky, do you have any last minute questions for the team that we can help with?
I'm great. I was actually just going to type a thank you. This was really good information. So thank you so much.
Very good
Thank you,
information.
Becky. Yes.
Okay. And again, as mentioned, we are recording this webinar, and we will have this available for viewing after today. So if you have colleagues that would like to hear this information that were not able to attend, we'd love for you to share out the link once it's ready. Okay.
Okay.
Thank you, Thank you, Dan.
Well, thank you.
And I
thank
didn't
you.
catch your name. What's the other gal? Your assistant's name?
Gabby.
Becky. Thank you.
No, Gabby, G-A-B-I.
Oh, Gabby. Sorry, I misheard that. Thank you, Gabby.
Thanks,
Appreciate
guys.
your
Well,
help today.
Thank you
Nice
for
to
the
see you.
opportunity. Have a great afternoon.
All right.
Thanks. Bye.
Thank you. Bye-bye.